This practical on the nervous system is the last then of 3 practicals where we did the muscular system and the front limb and the hind limb muscles, and we integrated with the nerves and the nerve supply to these muscles, but we also do the cranial nerves. And you were familiarized with this illustration which I used to show you the different nerves as they come out of the spinal cord. And I'll just orientate you on the illustration before we go to the dissection. In the neck region, I've got the nerves coming out at 90 degrees, although we know they do not come out like that, but at an angle. So the cervical nerves come out of the cervical region here on the carcass. Then the thoracic nerves comes out of the thoracic region, and then caudal to that, the lumbar nerves indicated there comes out of the lumbar region, and further caudally the sacral region where these last nerves come from. So the detail of the other nerves that also are shown, for instance, the parasympathetic and the sympathetic nerves, we've dealt with that at another practical. So I'm going to concentrate on the nerve supply to the muscles of the front limb, the intercostal region, the lumbar region, and the sacral region in my discussion where I will use the carcass to show you the nerves there. To show you the nerves on the carcass, we dissected the carcass and the front limb muscles, some of which we cut off in order to reflect the front limb from its normal position, to open up the axillary region to show some of the nerves. And I will start here in the neck region. At every segment, a cervical spinal nerve comes off, some of which also supplies front limb muscles. But then in the region of the last cervical to first thoracic spinal cord regions, in other words from C6 to T2, we get nerves that come off from the spinal cord. And if I move the spinal cord here, you can see where that nerve root that contributes to the brachial plexus comes off, and that supplies the front limb. So I'm not going into the detail of each of these nerves, but the principle remains the same. And you can see if I lift up the spinal cord at every segment, there are nerves that come off. These nerves in that region form the intercostal nerves that supply the intercostal muscles. And so the pattern goes on. And then in the lumbar region, which I'll show now, it just continues. The spinal nerves from the lumbar region that you can see comes off there. They run there in the lumbar region over the abdominal muscles, and specifically between the transverse abdominal and the internal oblique muscle to supply the muscles and obviously also the skin. Moving further caudally, as from L4, we get the roots that form the lumbosacral plexus. That would be L4, 5, and 6. And you can see they contribute in an overlapping fashion to, for instance, form the ischiatic nerve. And you can also clearly see how the spinal nerve on the inside of the vertebral column there goes through the intervertebral foramen to eventually form the nerve roots which go to the hind limb muscles. The spinal cord itself ends there with a lot of nerves, and that is the cauda equina, because it looks like a horse's tail. And then the last nerves that come out of the sacral region forms the sacral nerves, which are shown there. And there are a few of these nerves, for instance, the nervi pelvini, which is parasympathetic, and the nervus pudendus and the nervus rectalis caudalis. All 3 of these supply the pelvic organs, whereas these, in the more cranial part of the lumbosacral plexus, supplies the hind limb muscles. If we consider these nerves that come off from the last part, it is best if we look at an illustration of the region. If I can put that illustration in front first, just to orientate you. From L4 to L6, we get the femoral nerve and the obturator nerve. Then from L6 to S2, we get the ischiatic nerve, and then from S2 further caudally, we get the pudendus nerve, the rectalis caudalis, and all the nerves that supply the pelvic region, specifically then also the parasympathetic nerve supply, the nervi pelvini. So this illustration in the Technicolor that I've shown there helps to orientate one as to the lateral view of the lumbosacral plexus versus the dorsal view illustration that I started off with.